as we're getting older, y'all, let's be real. We're hearing about people just having heart attacks all of a sudden. And it's not something we heard about when I was younger. I didn't hear my parents' friends just dying of a heart attack all of a sudden in their 40s and their 50s. And so it is something that is a real big problem. Girl, Tiffany, guess what's been going on with me? I have been having like this serious heartburn, this right side, like my arm just like, man, it just feels like it just won't like, I got this pain and it just won't go away. And some serious pain between my shoulder blades, girl. I have no idea what the heck is going on.
You can't think of anything that you did that may have been like a muscle strain or
No,
nothing else that you could relate it to?
no, girl, nothing.
Well,
Absolutely
listen,
nothing.
let me tell you, we are at the age where our risk of heart attack and stroke is steadily increasing. And those symptoms sound like they could possibly be due to a heart attack.
Girl,
So you should not ignore those symptoms.
girl, yes. Well, girl, for that, let me grab my aspirin and head on our way to the hospital.
That's it. And on that note, exactly, we should all have some baby aspirin on hand unless your doctor has told you you cannot take aspirin for other medical conditions. We should all have baby aspirin on hand because that can be the difference in how much damage is done to your heart during the course of a heart attack. And then don't just say, well, let me just wait it out. I'm gonna see if I
Mm-mm,
feel better in the morning. No, no. Better
mm-mm.
safe than sorry. Take that baby aspirin, get to the ER and let them tell you that it's nothing.
Exactly. So as much as I am doing a reenactment and I don't have any of those symptoms, today, girl, we're going to talk about, are you having a heart attack, sis? That
Yep,
is the topic of our conversation because it is so important to know that as women, we have different symptoms than men having a heart attack. We all think
yes.
of when they say heart attack, they're going to be like
Hmm.
this elephant on our chest, and we're going to feel this heavy pain. But that is not the case with women at all.
That's right. That's right. And we do. I mean, there are some similarities. I mean, you're
Yep.
right. Everybody thinks of the left sided chest pain, the
Hmm.
pain that radiates down the left arm,
Right.
jaw pain is common
Yes.
in men and women. And everybody might get shortness of breath, nausea, and
Hmm.
vomiting. But women, in particular, the symptoms can be more vague, like feeling lightheaded or actually having an episode, a syncopal episode where you actually physically pass out,
Yes.
or
Sweating.
like you said, like the indigestion, like
Yep.
thinking it's heartburn. Our symptoms can present oftentimes in the upper abdomen,
Yes.
not in the chest.
Right. And then also, instead of the heaviness that we feel in the front, we may actually feel it as back pain, like in between your two shoulder blades, like in the middle. You may feel like, man, I just have this symptom in the back, in my back, on my upper back, and it just won't go away. You may not
Mm-hmm.
have the heaviness in the front. It may present as this aching kind of back pain in the back that won't go away.
Mm-hmm.
And also sometimes you may just start sweating for no reason. And you
Yeah.
may think it's a hot flash, y'all.
Yep.
And it's not necessarily a hot flash. In combination with all these other symptoms, it could definitely be something more serious like a heart attack.
That's right. Along those lines too, with the sweating, sometimes our symptoms of heart attack can even present like a panic attack. Like you
Yeah.
may feel a sudden sense of doom, or
Hmm.
like, oh my goodness, something bad is about to happen, and the panic that might be a new symptom for you that you've never experienced before. That's how that might present in a woman compared to a man.
Right. And this is, I mean, a topic that is near and dear to my heart. But because we, as we're getting older, y'all, let's be real. We're hearing about people just having heart attacks all of a sudden. And it's not something we heard about when I was younger. I didn't hear my parents' friends just dying of a heart attack all of a sudden in their 40s and their 50s. And so it is something that is a real big problem. And personally, I even had a cousin that passed away before a 42nd birthday of a heart attack. And so you don't think about those phone calls that you're going to get the cousin or the sister or the brother that has passed away at a young age because of having a heart attack or any cardiovascular disease, right? We
That's
don't think
right.
about that. So
That's
when we
right.
talk about that, there's some risk factors that make you higher at risk of having this to happen.
Mm-hmm.
Unfortunately, my cousin did have diabetes. As a result of her diabetes, she also had high blood pressure. So diabetes is definitely a risk factor.
Mm-hmm.
Hypertension, high blood pressure is a risk factor. Being being overweight, being obese
Yes.
is a risk factor.
Mhm.
Smoking is a risk factor.
Yes.
I mean, these are just the four that are the most common. I mean, unfortunately, the most common
Mm-hmm.
that make you a risk factor. Yeah.
Yes, and the thing is, that's the thing. I mean, with heart attack and stroke being the leading causes of death for women over the age of 40, we have to pay attention.
Yeah.
And we mentioned before, as we age, that risk increases. And women are more predisposed to these conditions because our life expectancies tend to be longer.
Yep.
And then we also have other factors like childbirth. Childbirth increases the risk because then you have the hypertension that may be associated, and the
Right.
diabetes that may be
Mm-hmm.
associated with pregnancy. But then those factors are also, or those risk factors are increased also as we go through menopause and perimenopause with the hormonal fluctuations. And if you choose hormone replacement therapy, that's going to increase the risk, or even
Right.
those of us who are childbearing age with birth control. Birth control increases the risk of cardiovascular complications. And if you stroke, if you smoke, on top of that, you're stacking those risk
Mm-hmm.
factors. But the thing is, those four most common risk factors, guess what? Are preventable.
Exactly. And even
Yes,
with getting older, we're talking about perimenopause. And just remember that if you're 40 and you're smoking, or at age of 35 and you're smoking, we shouldn't be on birth control anyway. So
cut it
please,
out.
if you turn 40, if you turn 35, right? Or you're, I mean, and you know, you got to get off that combination birth control with the estrogen.
Mm-hmm. Mm-hmm.
So you have to be mindful that all of these things are preventable. I mean, we can control your diabetes. You can
Yes.
control your hypertension. You can get that under control. You know what I mean? We've talked about weight and ways of diets. We've had, please look at our previous episode about the diets and fad diets and just knowing that you can, you know what I mean, control that too. Right.
That's
So these
right.
are, it's smoking.
Don't
Just
smoke.
stop. I mean, I know it's hard. Get some help to stop, and you'll save some money along the process. I mean,
That's
honestly,
right. That's
as
right.
far as smoking,
Yeah, I
right?
always say if you smoke, every other risk factor or condition is worse if you smoke.
Mm-hmm. Yeah.
So things that you don't have, smoking can cause. Conditions you
Mm-hmm.
already have, smoking will make worse. So just
Exactly.
really just work on getting that done and quit.
Oh, getting
And
it totally.
yeah, so the lifestyle factors, y'all know we say it. We talk about lifestyle every episode probably, because how we live, how we eat, and how we care for these bodies is going to impact every aspect of our lives. And I'm going to tell you,
Yeah.
1 in 5 women, 1, 2, 3, 4, 5, look at your friend
Mm-hmm.
group, 1 in 5 is going to have a cardiovascular complication, whether it be a heart attack or stroke.
Yes.
And we're talking now about the heart attacks, but stroke is the same exact pathology of
Mm-hmm.
a blockage of blood flow. It's a brain attack. So a
Yep.
heart attack is when you get decreased blood flow or a blockage of blood flow to an area of the heart. When that same condition happens in the brain. It's a brain attack, and that is what a stroke is. But the risk factors for both heart attacks and strokes are the same.
The same.
The same. And so we can manage the factors that increase the risk of both. And we need to do that because those risk factors increase as women age.
Yes. Exactly. So, y'all, as we talk about this today, it's just near and dear, I know, to my heart and also to Tiffany's heart, but you have to know your risk factors. Go to your doctor. If you have not, know your risk factors. I mean, come on. We all know obesity, we can step on a scale. We all know about that. But if you don't know your blood pressure, if you're high blood pressure, if you have diabetes, those things you need to go and determine if you have it, because the more you wait, the more you don't know, the worse the disease can happen. The more you don't know you have diabetes, the more higher your sugar is going to be. The more you don't know if you have high blood pressure. And unfortunately, high blood pressure is one of those things that doesn't hurt. You know what I mean? Diabetes doesn't necessarily hurt until it gets so bad to where it is where you're having a heart attack. You're, you know what I mean, in a coma, a sugar coma. I mean, so it doesn't hurt until it's really, really bad. So please know your number. Please go to the doctor, know your numbers, and keep that baby aspirin in the cabinet. Okay? You don't know how much it could save your life and when you'll need it.
And the thing is, we talked about the symptoms of a heart attack, but when we referenced the symptoms of stroke in one of our prior videos as well, and you can look at a more detailed discussion on stroke risk factors, stroke risk reduction, and management on if you refer to that previous video. But just a couple of things just to remember is the acronym FAST.
Yes.
FAST, of course, you're going to act fast because the more you delay in going to get help, the more brain you're going to lose. Yeah. And so as soon as so FAST stands for face. If you notice asymmetry in your face, if you smile and one side is drooping or one eye is drooping, that can be a sign of a stroke. Go get checked out. Yes. And then arm. The A is for arm. If one arm is weaker than the other, that is not something you sleep off. Okay? No. Don't go lay down and take a nap and say, let me see. No. Be like, go right on in there. Because truly, this is the thing. Some treatments are time limited. If you don't get to the ER within 3 hours of the onset of symptoms, you completely eliminate your options of treatment of the stroke. Yeah. Some treatments cannot be initiated or even offered to you if you come in there too late. Right. And then we got face, we got arm, and then S is speech. If your speech is slurred, or if you cannot understand the words that are spoken to you, or you can't form words, that's a problem. Get on in there. And then the T is time. And that's what I mean about time. Yes. 911, get on in there. Yes. FAST is the acronym. It's not the time to call your friend and tell them to take you to the doctor, to the ER. It's not. This is the one time you will hear a physician, a doctor tell you to call 911. This is the one time you call 911. That's right. Okay? Because they also have life-saving things that they can do for you on the way to the hospital that it can do in an ambulance that your friend's car or your husband's car won't be able to provide. So that's why 911 in this situation, and they can also start to identify, like Tiffany said, the timing of the event. So you do want 911 versus getting my friend's car or getting your car, because you don't want it to get worse. Also, do not get in your car either, because you don't want it to get worse and you're on the driveway, then you pass out, and then you get into a car accident. You know what I mean? Just call 911. Yes. I have heard so many patients tell me, well, I started feeling something, so I drove myself to the hospital. And I said, well, you are covered by grace and mercy. Don't do it again. No. Don't do it again, because you know, it's just not worth it. It's not worth the risk. And so we can manage these symptoms by lifestyle, eating a healthier diet, getting regular physical exercise, stop smoking if you smoke. And if you don't start. Exactly. And talk to your doctor about your current risk factors and what you need to manage to reduce your risk of stroke or heart attack.
So as this episode of are you having a heart attack, sis? Know the signs, know the symptoms, and know your risk factors. Tell your mother, your grandmother, your sister, your friend, because you never know the life that you may be saving just with this information. Okay?
Right.
And buy that baby aspirin, because the life could be yours. All right, y'all. Please like, share, tell everybody, and we will see you soon. Have a good evening.
Bye for now.